you're well known for your ability to put IVs in anybody and anything. You've been doing this for how many years?
26 and a half years.
26 and a half years.
Working with kids, a lot of it, you've got to have a good holder. Usually 2 people have to go in when you're putting an IV in a child. Got to have a good holder that can help you out, hold the child still while you control the arm, leg, whatever you're sticking, and be able to control your IV.
So do you have any tricks on holding the child still?
Mm-hmm.
I mean,
make sure when they're holding, and if you can see me, make sure when they're holding, if they'll hold the shoulder down, then you still have the ability to move the arm as you need it for the IV placement. The child is held still. They can still kick their little legs if they want to, but hold the shoulder down so it's, they're not able to roll away from you. Especially with kids that are a little harder to find an IV or a vein in, you can use 2 tourniquets, one upper, one lower. Then that way you don't have your blood's not flowing back. You've kind of basically cut off the circulation. You will have something show up. We stick in abnormal areas, fingers, as long as you let your physician know that you're sticking a finger or thumb. In between the fingers, in between the thumb, there's veins there. You got to kind of look at your anatomy. If you see it on your hand, it's in a child.
Having a basic understanding of the anatomy, even just a visual understanding. You may not know the name of the vein, but you say, I know there's a vein that travels here on the hand or down near the ankle.
You know it's there. Saphenous veins are really easy to stick in children. They might be a little chunky and hard to feel, but the saphenous vein is there.
All right, good.
Okay, so it's easy to find, easy to stick. Another thing is that it's a feeling. When physicians are doing a lumbar puncture, they'll tell you they can kind of feel when the needle gives when they're in the space to get the spinal fluid. Same feeling, I can feel it when I stick the vein, it kind of gives.
So even the smallest vein?
Yes. You've got to be patient. You can't go at it with force. Be patient. When you feel that give, wait just a second to see if you've got your blood flow back, thread it on in.
So as you're putting the catheter in the vein, I mean, are you just moving forward steadily, or are you just doing a little bit at a time?
Steady. And this is to me, because I've had IVs before, going little by little by little. You can feel it go through every layer of your skin. Once you feel committed, and that's the vein I'm going to do, go for it.
Okay.
Go ahead, get it under that skin, then push it in the vein. Don't inch. That's what causes the kids to start pitching a fit.
How do you put a tourniquet on the scalp?
Put a rubber band.
Okay.
Actually put a rubber band around instead of a tourniquet.
So on that rubber band that you're putting around the scalp, do you put a piece of tape on that so that you can pull it off easily?
Now, this is just me. Usually I'll put a piece of tape, and then there are a few things when little babies, especially if they're mottled and younger children, once you put a tourniquet on, it's very hard to see if they're mottled. Everything turns a purpley blue color. You can, whoever is assisting you, they can be your tourniquet. That way they can loosen the pressure or make it tighter as needed, and the modeling won't be as bad.
If you're putting an IV into the dorsum of the hand, how do you hold that hand? I mean, do you flex the hand? Do you flex the hand down like that?
If it's a child, and if I had a kid, you see how my hand's in the shape of a C. If it's a kid, I would catch their fingers down here, their hand up here, and kind of pull it like this. Then that has actually gotten your skin taut here and is holding that vein in place. You hear people all the time say, I have rolling veins.
Yeah.
Pull it tight, the vein's not going to move. Now, you're not going to pull it so tight it actually inflicts pain on the child, but pull it down and you've got it stable.
Yeah.
The whole time. You've got their hand stable, they can't pull from you, you've got the vein held stable.
So when you're putting an IV in the scalp, are you going caudal, or are you going okay, so that's always a question that pops up.
And you'll know, you always feel, especially in the scalp, you need to feel. Make sure you don't have a pulse, because you've got your artery that runs right here, which you will, as soon as you hit that, you will know if you've hit the wrong thing.
Yeah, it sounds like you're speaking from experience.
I have done that before, but you will know. It's definitely an arterial blood that you get back.
So if a child is like severely dehydrated, do you have any unique approaches to that?
That's when the 2 tourniquets really come in. We have a lot of kids come in DKA, so their veins are flat as they can be. That's when they putting the one tourniquet up, putting the next tourniquet down here, and waiting.
Okay.
Same thing with that. That's another one of those. You've got to feel it. A lot of times you cannot feel the actual vein. You can see maybe a little spider vein. That's when the act of when you feel it give, you know you're in there.
Okay.
Wait just a second, because they're not going to bleed back as fast. Your return's not going to be as fast, so give it just a second. If you feel like you're in there, give it a second. Look for that return, then thread your needle in. We've been talking about people that thump first slap. I have always been a thumper, but we're going to show slapping technique. You can see it's kind of fluffing up a little bit versus a little thumping. And now look how good and juicy that vein is.
That's interesting.
Everybody holds a gel coat different. When I'm holding, I hold the gel coat like this, if you can see my hands. When I go to stick her, she's got a nice juicy vein. I would stick, as soon as I get a blood return, this finger pushes the catheter off while these fingers are pulling the needle out at the same time.
Because you don't want to let go of the child.
Okay?
Okay, got it. Good,
A
good.
lot of people want to do it, do like this, which is fine. In older adults, you can do that. We work with pediatric patients. You really can't let go of this hand to thread it in. So it's best if you can use, and it takes a while to get used to moving your fingers like that. But just push, the same time you're pushing the catheter off with this finger, you're pulling the needle back with your thumb and middle finger.
Excellent. What about your demeanor?
When you go in the room, especially with pediatric patients, working in the pediatric world, you're not only taking care of the patient, you're taking care of the family. When you go in the room, go in with confidence. I'm trained to do this. I know what I'm doing. I've got all my stuff. Don't let them know, even if you are nervous, don't let the family see that. Go in with your confidence. I've been doing this my whole life.
What's your thoughts on compresses, warm wraps?
We will do that, especially children, got a little cyanosis in their lower extremities or in their hands. They're cold.
When you're putting an IV in, do you go for the antecubital first? Do you
No.
go for the hand?
I always tell them when I'm training, and I do this too, start with your hands, work your way up. Same if you've got to go in the foot, start with the foot, work your way up.
Okay.
If a child or adult, whatever, needs to be admitted to the hospital, that IV site has to be changed every 48 to 72 hours. If I've already stuck the antecubital, it's going to be hard for me to keep going up. Start with your hands. If you absolutely can't find anything in the hands, go to your forearms, your wrists, slowly come up.
Gravity? Does gravity help? Do you
Yes.
use gravity?
So just sit there and give it a few minutes with the arm hanging off the side of the bed. That's in older patients. It's kind of hard in babies to really get that.
Talk about angles of insertion. So when you're basically gonna, are you going like 30 degrees, 15 degrees?
Usually you're going about 30 degrees. Now it is going to depend.
How much adipose tissue is there?
Yes, might go a little more of an angle. Infant babies, we see anything from the day they're born until they're 19 years old. So you've got a 2-day-old, they don't have a lot of adipose tissue, so you're going to go at a flatter angle. Going to go basically kind of even with the skin. You don't want to go too severe of an angle, there's nothing there way through.
So let's say you're doing a steeper angle at first because there's adipose tissue. Then do you
Then
drop your angle?
Yes, you drop your angle. Once you get under, drop your angle and then start.
Are there any special tricks on taping as far as stress taping?
And especially in children and taping, we always put like what's called a tegaderm. So that's a clear site that we can see the IV site through. Then we put a chevron to kind of hold it in place. Then we will actually loop. All pediatric patients in our facility have to have what's called a T-connector on. We will loop it around and secure that. So if the child is pulling, if he's hooked IV fluids or she's hooked IV fluids, and they're pulling, that secures it so they're not actually pulling on their IV site. They're pulling at that T-connector.
Do you ever find yourself using butterflies? So the reason I ask that is that's all we did when I was a resident.
We've got butterflies are 23 gauges.
Yeah.
We have 24 gauge.
We use 25 gauge butterflies.
Yeah.
A lot of times we'd tape them, they'd be in there for 2 days.
Keep in mind, butterflies are metal.
Yep.
So there's no way. So if you've got a kid that's sitting there bending, you really don't want that metal catheter in
You
their
have to really
skin.
tape
So
them
we've
down
got
well.
we've got a 24 gauge Gelco, really small, that we can use in the infants. We will use butterflies if we're drawing blood on patients and not leaving an IV in. We have actually used a butterfly before just to push maybe solumedrol through and we weren't leaving the IV, but they wanted to give it intravenously instead of IM, we'll put the butterfly in and push the med through and then pull the butterfly back out.
Okay.